Hey guys, it's Medicosis Perfectionalis, where medicine makes perfect sense. Let's continue the physiology playlist, and today it's time to talk about the types of hypersensitivity reactions. We have type 1, type 2, type 3, and guess what? Type 4. And this classification is based on what, Medicosis? Based on the time, mainly. Type 1 is the fastest, type 4 is the slowest. This is my physiology playlist. Please watch these videos in order. In the last video, we talked about the complement system with the 3 pathways. Hypersensitivity, type 1, type 2, type 3, type 4. Type 1, immediate, but type 4 is delayed. Okay, how about type 2? Cytotoxic. Look at this. Type 2 is cytotoxic. And type 3, you have free antibodies. What do you mean by free? I mean the antibodies are floating in the plasma. They are floating in your blood. They are not bound to cells. They are not cyto like type 1. Also, you can describe type 3 by 3 words: serum immune complexes. Hypersensitivity, which one is the fastest? Type 1. Which one is the slowest? Type 4. Can you describe type 1 in few words? Sure. Immediate, anaphylactic, IgE, mast cells. They rupture, pew, they degranulate, pew, releasing histamine. And histamine can give you the symptoms of an anaphylactic shock. How about type 2, cytotoxic? What do you mean? I mean, I have antibodies, okay? These antibodies are bound to antigens, okay? And this happens on the surface of the cell. The cell is the cyto. That's why type 2 is cytotoxic. Okay, how about type 3? 3 is free. You have antigens and antibody complexes. Same as 2? Yeah, but with one difference. The big difference is this happens in the blood. And after this, since they are hanging around in the blood, the antigen-antibody complex can end up being deposited in the blood, causing vasculitis, in your joints, causing arthritis, in your kidney, causing nephritis, etc., etc., etc. In type 1, type 2, type 3, we talked about antibodies like IgE, like the antibody that is cytotoxic, like the antibody that's freely floating in the blood. But type 4 has nothing to do with antibodies. Type 4 has nothing to do with the humoral immune system. Type 4 is about T lymphocytes, cell-mediated immunity. No antibodies? Heck no. The T lymphocytes are super sophisticated. They communicate with each other via cytokines, which include the interleukins, which is the internet of the leukocytes. This is also the story of making a granuloma, and this takes time. Here is a quick overview of the 4 types of hypersensitivity. Type 1, immediate, okay, within minutes, alright? Humoral immunity, which means I'll say antibodies, yes, such as IgE. Immediate, humoral, preformed antibodies. Remember, IgE is ew. What do you mean by ew? Allergy, anaphylaxis, atopy, asthma, eosinophil, ew, bee sting, ew. How about type 2? Type 2 is cytotoxic, okay? We have an antigen-antibody complex. We're on the surface of the cell. And these antibodies could inhibit the target most of the time, or they could stimulate the target in one case only. That's why some crazy textbooks define this specific type as type 5 hypersensitivity. But this is a very bizarre classification that only lasted for 5 minutes, and then they went back to classifying hypersensitivity as 4 types. Can they inhibit the target? Sure, they can cause inflammation and cell dysfunction. Inflammation is seen in anti-glomerular basement membrane antibody disease, also known as Goodpasture syndrome, rheumatic fever, hyperacute transplant rejection. This is how your body rejects organs. Or they can cause cell dysfunction such as myasthenia gravis and pemphigus vulgaris. My muscles are in trouble, my skin is toast. They stimulate the target organ only in one case, which is the case of Graves' disease. I have antibodies against the receptor. Okay, what kind of receptor? This is the receptor waiting for the TSH. So it's called the TSH receptor. Okay, but these antibodies will come and stimulate the target. Have you ever heard of antibodies that stimulate the target? No, antibodies are weapons of destruction. Now this is an exception. These are antibodies that stimulate the target, leading to what? Well, it's as if TSH is binding to its receptor. Oh, so a similar effect? Yeah. What does TSH do? It tells the thyroid gland to secrete tons of thyroid hormone. So Graves' disease, in a sense, is a type 2 hypersensitivity reaction. Okay, how about type 3? Type 3 is also antigen-antibody complex in a different location, floating freely in the plasma. Okay, this is the cause of serum sickness, which is a diffuse and acute reaction, or the Arthus reaction. It's not diffuse, it's very localized in one spot on your skin, and it's not that acute. Arthus is subacute. Serum sickness is generalized, Arthus is localized. Serum sickness is acute, Arthus is subacute and subcutaneous. Love it. Subacute, subcutaneous. Type 3 is also the tragic story of the nasty immune-mediated vasculitis, when these antigen antibody get deposited into the wall of the vessel. This is vasculitis. They can also get stuck into your kidney. This is called immune complex mediated nephritis. Or into your joints, immune complex arthritis. This is what happens in lupus. This is what happens in rheumatoid arthritis and gazillion other diseases. How about type 4? Type 4 is the most delayed, 3 days, or about 72 hours, or slightly less, slightly more. This is cell-mediated. I'm not gonna send antibodies to destroy. No, I, myself, I'm gonna go and kill that bacteria face to face. I'm gonna have a strong word with this tuberculosis face to face, cell to cell, cell-mediated or cellular immunity. If I can kill the stupid invader, I will destroy it. How will you destroy it? Well, we are T lymphocytes. We have T cytotoxic cells. We kill. Okay. But if I can't kill it, well, at least I can surround it in a granuloma. This granuloma can have caseous necrosis, such as the caseating granuloma of tuberculosis, histoplasmosis, blastomycosis, coccidioidomycosis. Or it could be non-caseating, basically any other granuloma is going to be non-caseating. A famous example is sarcoidosis. How to make a granuloma is a story that we'll talk about soon, but basically, CD4 T lymphocytes will secrete interferon gamma, which will stimulate the macrophages to make the granuloma. We're done with the overview. Now let's get into specifics. Here's type 1 hypersensitivity reaction. With the first exposure, an antigen enters into my body. Could be dust, pollen, etc. Now it's in my body. Who's gonna present it? The antigen presenting cell is gonna take that antigen, process it, and present it. To whom? To your lymphocytes. So that the lymphocytes can stop being so naive and grow the French toast up. When they grow up, they become helper cells. Helper cells. Okay, are you talking about T helper 1? No, T helper 1 is for type 4 hypersensitivity. I'm talking about T helper 2. T helper 2, the one that helps the neighbor? Yeah, and who's your neighbor? The B lymphocyte. How would you help them? I will help them develop from a naive B lymphocyte into a grown-up, mature B lymphocyte. From a lymphocyte that can only make IgM and IgD to a mature B lymphocyte that can give you all kinds of antibodies, IgM, IgA, IgG, IgE, IgD. I did this by the means of interleukin-4, especially to make IgE. So interleukin-4 comes from the Th2 to stimulate the B lymphocytes to become mature B lymphocyte, which secretes IgE. Okay, I also secrete interleukin-5, which stimulates eosinophils. But this will happen more with the second exposure. So tell me about the second exposure. Second exposure to the same stinking antigen. Okay, we call this re-exposure, which causes cross-linking of two IgE molecules on the surface of the mast cell. The mast cell is full of histamine, waiting to explode. This cross-linking of the two antibodies by the same antigen is the straw that broke the camel's back, causing mast cell degranulation. Pew! Releasing all kinds of mediators, such as histamine, serotonin, eosinophilic chemotactic factor. Since it's called chemotactic, it's going to attract, taxi, from movement, the eosinophils by the means of chemicals. What does histamine do? Bronchoconstriction, vasodilation, increased capillary permeability, which causes exudate, and welcome to the land of acute inflammation. What does serotonin do? Bronchoconstriction, vasodilation, and increased capillary permeability. Welcome to the land of acute inflammation. Oh, by the way, these are preformed amines. The histamine was already made and ready and loaded inside the mast cell. We did not make it de novo. The histamine was already there inside the mast cell, which was already there, just ready to explode, waiting for the trigger. Number 3 is the eosinophilic chemotactic factor, which is going to recruit the eosinophils. Now the eosinophils came to play. To do what? To secrete histaminase. Why? To clean up this mess. To metabolize histamine into degradation products. Think of this as a kind of a negative feedback thing, okay? They also secrete aryl sulfatase, which also metabolizes histamine and leukotrienes. So far, you know the story of the first exposure to the antigen and the early phase of the second exposure. The story of the histamine, serotonin, and eosinophilic chemotactic factor. But let me add another aspect, the late phase of the second exposure to the same freaking antigen. What's gonna happen here? The release of prostaglandins, leukotrienes, and platelet activating factors. So the early phase was histamine, serotonin, eosinophilic chemotactic factor. The late phase is prostaglandin, leukotrienes, and platelet activating factors. What do prostaglandins do? Bronchoconstriction and increased mucus secretion. What do leukotrienes do? Bronchoconstriction, vasodilation. What do platelet activating factors do? They activate the platelet. Oh, that makes sense. These mediators will prolong the inflammation initiated by the early phase. And this happens by recruiting neutrophils, eosinophils, and monocytes. Unlike the early phase, where these mediators were pre-formed and ready to explode, the late phase mediators are made on demand, de novo, from scratch, new stuff. These were already there before we saw the antigen for the second time. They just happened to come out of the closet. However, these were not already there. These are made on demand. And that's why the late phase is late. A classic example of type 1 hypersensitivity is the extrinsic allergic asthma. And we have discussed this in detail in my pulmonology playlist. These videos are on YouTube, the notes are on my website. Next, we have type 2 hypersensitivity reaction. What's the keyword? Cytotoxic. What do you mean? Antigen-antibody complex on the surface of the cell. Okay, an antigen and an antibody. They make a complex. Where is the complex? On the surface of your cell membrane. And then what's going to happen? There is a story with a complement and there is another story with no complement. If there is a complement, I have two sub-stories for you. IgM or IgG. These are the only two antibodies that can fix the complement. What do you mean by fix the complement? Fix it in place and activate it to end up with the MAC, which will attack. Watch my last video, please. This antigen-antibody complex triggered the classical complement pathway, which ends up with membrane attack complex. The MAC will attack, causes all kinds of destruction and lysis and breakdown, etc. Cytotoxic. Or I can stimulate macrophages to phagocytose. Quick reminder, the complement is called complement because it complements the function of the antibodies. The complement also produces proteins necessary for inflammation and opsonization. Oh, it actually makes sense. They are coordinated. The second story where you have no complement. We have two sub-stories here as well. ADCC and antibodies against cell surface receptor. What the flip is ADCC? Antibody dependent cell-mediated cytotoxicity. Beautiful. I can have IgE or IgG. IgE can recruit eosinophils, as was the case with type 1 hypersensitivity reaction. This is the story of ew, allergy, asthma, bee sting, anaphylaxis, parasites, etc. Eosinophils. Or the IgG activating and recruiting neutrophils and monocytes. Whether we're talking here or here, the end result is the release of inflammatory mediators causing cell lysis. Cytotoxic. Or it could be antibodies against cell surface receptors. What do you mean? I mean a receptor on your own cell. Okay. And the end result could be stimulation of the target organ, as in the case of Graves' disease, hyperthyroidism, or it could be inhibition of the target organ, as in the case of myasthenia gravis, which we have discussed in my muscle physiology series. It is the norm for antibodies to inhibit the target, but when you stimulate the target, this is unusual. That's why in the past it was known by some doofuses as type 5 hypersensitivity reaction. But no more, because the pathogenesis is the exact same as type 2. Next, we have type 3 hypersensitivity reaction. If you remember my videos on rheumatoid arthritis, I've told you about the story. We have a rheumatoid factor. What's that? It's IgM antibody against the Fc portion of IgG. Okay, this is an antibody against an antibody. Isn't that crazy? Yeah. In this case, the IgM is acting as the antibody. The IgG is acting as if it's an antigen. But this is your own antigen. That's why in rheumatoid you are destroying your own body, not the body of a foreigner. Antigen-antibody complex are floating freely in the circulation. When it's free, it's type 3. These are not bound to cell surface, and the end result is deposition into tissues. If they get deposited into the vessel wall, they cause vasculitis. Into joints, they cause immune complex mediated arthritis, immune complex mediated nephritis. Stop wondering why do we have skin involvement in cases of rheumatoid, lupus, scleroderma, etc. It's here, baby. Moreover, this antigen-antibody complex that's floating freely in the circulation can activate the classical complement pathway and giving you the famous C5a, which is famous for chemotaxis, which means neutrophils are coming, causing all kinds of inflammation. Do you remember fibrinoid necrosis in pathology? Yeah, this is deposition of antigen-antibody complexes into vessel walls. That's why you see fibrinoid necrosis with rheumatoid, with lupus, with scleroderma, etc. Tell me more about type 3 antigen-antibody complex in the circulation. Could be a generalized reaction all over the body, or it could be a localized reaction, such as King Arthur. King Arthur is very local. The generalized type has two subtypes. The first one, it's not your doctor's fault. That's the story of the autoimmune disease, such as rheumatoid or lupus. Or it could be your doctor's fault. Hashtag serum sickness reaction. You had a disease. Your doctor injected you with another serum from another body, could be the body of a human, a horse, or recently made in the lab. Why did my doctor inject me with these antibodies? Because you had a disease. These antibodies were supposed to help your immune system. Okay. They can help your immune system, but everything has a trade-off. Like what? You developed your own antibodies against the foreign antibodies, ending with an antigen-antibody complex that's floating freely in the circulation, ends up depositing into tissues, activating the complement, hypocomplementemia, and you get all kinds of generalized symptoms. Contrast this generalized serum sickness reaction caused by the anti-serum with the localized Arthus reaction. Serum sickness reaction is generalized, Arthus is localized. Serum sickness reaction is acute, Arthus is subacute and subcutaneous. Someone injected me with something subcutaneously or intradermally. What happened? The problem is I was already pre-sensitized. Oh, you were sensitized to the same antigen before? Yes. And now with this exposure, I developed a small, localized, subacute, subcutaneous or intradermal lesion. This is the Arthus reaction. Hey Medicosis, like 5 years ago I got my flu shot and after that I developed a localized red skin lesion. What's that? That's your Arthus reaction. Do you remember serum sickness reaction? Yep, there is something similar called not serum sickness reaction, but serum sickness-like reaction. Oh, okay Medicosis, first let me tell you what I know about the serum sickness reaction. It is type 3 hypersensitivity reaction. It's a generalized acute reaction caused by my stupid doctor, right? Very close. Serum sickness-like reaction is kind of similar but not the same. It's not caused by the anti-serum or the serum containing the antibodies. It's caused by infections or drugs, such as hepatitis B virus or medications such as penicillin or monoclonal antibodies, causing similar symptoms such as urticaria, arthralgia, proteinuria, fever. This is the serum sickness-like reaction. Type 1, Type 2, and Type 3 hypersensitivity reactions, we're dealing with antibodies. We're dealing with humoral immunity for the most part. But here, in type 4, we're talking about cell-mediated immunity for the most part. It's not antibodies, it's not B lymphocytes, it's not humoral, it is cell-mediated. It is T lymphocytes. That's why it's delayed. Are you talking about CD4 T lymphocytes or CD8? It could be either. Oh, okay. Tell me the story. Here is the antigen presenting cells, presenting the antigen to the T lymphocytes, specifically the CD4. The CD4 secrete interleukin-2. The interleukin is the internet of the leukocytes. This is how they communicate with each other. Now, the CD4 positive is very active. It's going to secrete interleukin-12. Also, the macrophages secrete interleukin-12. Don't forget that the macrophages could act as an antigen-presenting cell. The end result is interleukin-12 activating my Th1, T helper 1. Is this the one that helps the sister or the neighbor? It helps the sister. It helps other T lymphocytes. It does not help the humoral immunity. It helps the sisters, the cell-mediated immunity. It can also secrete interferon gamma to activate macrophages. If the organism is weak, destroy it by phagocytosis. But what if the organism is nasty and virulent and strong like tuberculosis? If I cannot kill it and eat it, let me at least surround it in a granuloma. The idea that the T helper 1 CD4 T lymphocytes secretes interferon gamma to activate the macrophage is one of the most commonly tested facts on any exam. Never ever forget this. Type 4, we're talking about cell-mediated immunity. T lymphocytes, CD4 cells, especially the Th1, secrete interferon gamma to activate macrophages. Low virulence organism, phagocytosis. High virulence organism, make a granuloma, such as tuberculosis, histoplasmosis, blastomycosis, coccidioidomycosis, or sarcoidosis. In this case, the granuloma is not against a foreign invader. Okay, Medicosis, how can we run circles and make a granuloma around the Mycobacterium tuberculosis or the tubercle bacilli? Let's go! Let's go. Here are Mycobacterium tuberculosis bacilli. We will surround them with whom? With macrophages. Macrophages are here known as epithelioid histiocytes. Epithelioid because they look like epithelial cells. Histiocytes because they are in the tissue. They are not floating freely in the bloodstream. When they are floating freely in the bloodstream, they are called monocytes. But here they are stuck in tissues. Histiocytes. Don't forget, who activated the macrophages? T helper 1. Are they CD4 or CD8? CD4. T lymphocytes or B lymphocytes? T lymphocytes. They will also come to run circles around tuberculosis. Something weird will start to happen. Many of these macrophages will join forces, combine together to make this humongous, multinucleated giant cell discovered by Langerhans, the same scientist who discovered the endocrine cells in your pancreas. Probably the same doofus who discovered Langerhans cell histiocytosis, aka histiocytosis X, discussed in my pulmonology playlist. So we have the stupid TB here, and then we have our own macrophages called epithelioid cells or epithelioid histiocytes. Then we have the CD4 T lymphocytes. And don't forget, some of the macrophages will change into multinucleated giant cells. Is this an acute destruction? No. The whole purpose of the granuloma is that I could not destroy the bacteria acutely. Therefore, this is a chronic thing, which means you will need plasma cells. Okay, they can come too. More importantly, fibroblasts will come. What do fibroblasts do? They lay down some butymous fibrous tissue like this. Oh, okay. So that you can surround the tuberculosis. You can imprison the TB inside this doozy granuloma. As long as your immune system remains strong, the TB will be in prison for life. The moment your immunity drops, you're in trouble. Hashtag TB reactivation. That's why TB reactivation is common in the elderly, in the immunocompromised, in HIV patients, in patients with uncontrolled chronic diabetes, in patients taking chemotherapy, in patients receiving organ transplants, in patients taking immunosuppressive drugs such as the biologics, etanercept, adalimumab, infliximab, etc. And then what's gonna happen? Oh, let's cause some necrosis. Okay, cell death then. Yeah, let's kill some of those cells. All right. That's some necrosis for you. Okay, what kind of necrosis? Is it coagulative necrosis? Nope, this is caseating necrosis. I know it might sound cheesy, but that's because it is. Caseating means like cheese. When you see caseating granuloma like this, you know that there was probably an organism there. Could be tuberculosis, histoplasmosis, blastomycosis, coccidioidomycosis. But that's not true with sarcoidosis. There is no organism in the middle in sarcoidosis. Sarcoidosis is your body attacking itself. Who else is gonna explain to you like this? Your woke professor with his PowerPoint? No. Give me examples of caseating granuloma with caseous cheesy necrosis in the center, tuberculosis, histoplasmosis, blastomycosis, coccidioidomycosis. Basically, anything else is going to be non-caseating granuloma. Now let's review the 4 types of hypersensitivity with clinical examples. Type 1, this is the example of asthma. We have 2 types of asthma, extrinsic, which is allergic, and intrinsic, which is non-allergic. This is, of course, the allergic one, because hypersensitivity is a heightened allergy. Have you ever wondered why we can treat asthma with lipooxygenase inhibitors and leukotriene receptor antagonists? Yeah, because leukotrienes are involved in the late phase of the second exposure to the same freaking antigen. Could be dust, could be pollen. Ever wonder why we give asthma patients mast cell stabilizers such as cromolyn, nidoquercetin, ketotifen? Oh, because they stabilize the mast cells, the releasers of histamine. Have you ever wondered why we have monoclonal antibodies against interleukin-5 for asthma patients? Yeah, because they destroy interleukin-5. No interleukin-5, no eosinophils. Can I give this drug to a patient with COPD? COPD is not caused by eosinophils, so most probably not. Why do we give inhaled steroids for asthma patients? Because steroids inhibit the production of prostaglandins and leukotrienes. Watch my video on the arachidonic acid pathway. Ever wonder why we have monoclonal antibodies against IgE for asthma patients? Yeah. Why is aspirin bad for asthma patients? Because it increases leukotrienes. Why are beta blockers bad for asthma patients? Because they block the beta 2 receptor, causing bronchoconstriction, more wheezing. Inhaled corticosteroids include budesonide and fluticasone. The anti-leukotrienes, you have the LOX inhibitor xylutin, leukotriene receptor antagonist zafirlocast. The mast cell stabilizer is cromolyn. The monoclonal antibody against eosinophil is benralizumab. Against IgE is omalizumab. And don't forget your beta-2 agonists, muscarinic antagonists. Asthma has 2 things, decreased diameter of the bronchi, #bronchoconstriction, and increased bronchial secretion. And this is type 1 hypersensitivity reaction. So type 1, what do we have? We have asthma. Now let's talk about type 2 hypersensitivity. The complement mediated includes rheumatic fever, anti-glomerular basement membrane antibody, also known as good pasture syndrome, and hyperacute transplant rejection, which happens very quickly. The surgeon is inserting the new kidney into your body. While completing the job, the kidney is dying on the spot, live. What's that? Hyperacute rejection. Tell me about the non-complement mediated. Well, if you're talking about ADCC, this is the story of autoimmune hemolytic anemia, immune thrombocytopenia, and hemolytic disease of the newborn. If you're talking about antibodies against the cell surface receptor, if you're inhibiting the target, most of them are like this, example myasthenia. If you're stimulating the target, it's a singular example called Graves' disease. Type 3, the generalized. If it's not your doctor's fault, this is the story of the fibrinoid necrosis, immune complex mediated vasculitis, nephritis, arthritis, etc. That's lupus and rheumatoid arthritis. Serum sickness reaction is generalized and acute, and this is the reaction to receiving an anti-serum, which means serum that has antibodies. These are not your own antibodies. Localized type 3 hypersensitivity is the Arthus reaction, which means subacute, which means localized. This is post-vaccine skin reaction. Type 4, T lymphocytes. T lymphocytes, tuberculin skin test. This is for tuberculosis, the granuloma. It's for transplant rejection, such as acute rejection, chronic rejection, but not the hyperacute organ transplant rejection. Touching, what do you mean? Contact dermatitis. This is the story of poison ivy. This is the story of wearing a new nickel watch on your wrist and developing a rash on the same wrist, and the rash looks exactly like a watch. This is the story of trying new makeup, and 3 days later, you developed a reaction exactly where you applied the makeup. This is also the story of graft versus host disease. If you like this video, you will adore my renal physiology course, available at medicosisperfectionalis.com. Comes with 10 videos, 10 cases with notes, of course. I also have an endocrine pharmacology course. Learn everything you need to know about insulin, the different types of insulin, how to calculate the dose of insulin, and much more. Thank you for watching. Please subscribe, hit the bell, and click on the join button. You can support me here or here. Go to my website to download my courses. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.